We've been talking about it this week. Several public beaches and swimming areas in our state have been closed due to elevated bacteria levels in the water. So right now, two state parks remain closed: Lake Warmog in Kent and Indian Wells State Park in Shelton. Joining us now is Dr. Melanie Raffoul, Chief Medical Officer at Yale New Haven Health Urgent Care, to tell us about the risks and how you can protect yourself. Doctor, welcome. Great to have you.
Thank you for having me. Pleasure.
Well, this week, there's been testing that's done at swimming areas in our state, and it's done weekly from Memorial Day to Labor Day. But can you tell us, what are the risks associated with bacteria in water at beaches, lakes, or ponds?
Certainly. So, this testing, as you said, happens weekly during this time period, and it's really looking at levels of specific bacteria in the water. I believe these tests were triggered, these closures were triggered because testing for enterococcus, which is a bacteria in your gut that can be found in your gut, was high. The risks are that you could, usually between 1 to 3 days after exposure, that you could fall ill. Most often it's with an intestinal illness, vomiting, diarrhea, nausea, that kind of thing, which could lead to dehydration. Fevers are possible, ear infections also, as well as eye infections. And if you have a break in your skin, you are at risk for having a skin infection after being exposed to bacteria in the water.
So what do we do if we get a cut or scrape in the water? What do you recommend?
If you have an open break in your skin, maybe avoid the water unless absolutely necessary. Rinsing off and remaining clean, and then drying as well as you can after a water exposure is also something that you can do to help mitigate your risk. Um, Being aware of where you might have vulnerabilities or breaks in your skin is also extremely important, so you can make good decisions.
Do you see many cases this time of year that's related to bacteria in the water during summer months?
We certainly see an uptick in things related to water or water exposure, like swimmer's ear. Ear infections, both in the inner ear and in the outer ear, that could be related to being exposed to something in the water. That happens even when beaches are not closed. So it really depends on people's vulnerabilities and how exposed they were. Um, it's always a risk, and we just keep an eye out for it.
How do we protect ourselves? What do you recommend?
If you are immunocompromised, or if you have deficiencies or trouble fighting off illnesses, and you know that you're going to be near water, be careful. If you hear about a closure, follow it. If you're going to be in the water, when you get out, rinse it off and dry up as best as you can. And if you have a break in your skin, beware. Um, what you're trying to prevent is substantial exposure to the bacteria that can then sort of tip the scales and make you fall ill. So just being aware of the risks in your environment is extremely important.
All right, Dr. Melanie Raffoul, Chief Medical Officer at Yale New Haven Health Urgent Care. We appreciate your time and advice today.
Thank you. Thank you for having me.
Thank you.